Hello, good morning viewers. In this video we are going to discuss about physiological factors affecting sleep. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing, Chennai. The objective of this video, at the end of the section, the students are able to define what is sleep, describe the stages of sleep, and list the various factors that affect the sleep. First, we will see the definition of sleep. Sleep is a state of reduced mental and physical activity in which consciousness is altered and sensory activity is inhibited to a certain extent. During sleep, there is a decrease in the muscle activity and interaction with the surrounding environment are significantly reduced. Next, stages of sleep. Sleep is divided into two broad types, that is non-rapid eye movement and rapid eye movement. Non-rapid eye movement we used to call as NREM and rapid eye movement REM. Non-rapid sleep occurs first and after the transitional period is called slow wave sleep or deep wave sleep. During this phase, body temperature and heart rate falls and the brain uses less energy only. See that non-rapid eye movement stage 1, non-rapid eye movement stage 2, usually we used to call as light sleep. Non-rapid eye movement stage 3 and rapid eye movement, that stage 4, that is deep sleep. Okay. The light sleep falls around that stage, non-rapid eye movement NREM lasts about 4 to 7 hours per night and rapid eye movement lasts for about 1.5 to 2 hours per night. Stages of sleep. We already discussed about the stage 1, stage 2, stage 3 of non-rapid eye movement and rapid eye movement, usually we use it to call as stage 4. The rapid eye movement sleep, also known as paradoxical sleep, represents a smaller portion of the total sleep time. It is the main occasion for dreams or nightmares. Stages of sleep. The sleep cycle of alternative NREM and the REM. Sleep takes an average of 90 minutes, occurring 4 to 6 times in a good night sleep. So, you all know the ideal time for sleep is 8 hours to 10 hours per day. In that, this cycle continuously happening. Okay, and the American Academy of Sleep Medicine divides NREM into 3 categories, that is N1, N2, N3. The last of which is also called as delta sleep or slow wave sleeps. The whole period normally proceeds in the order of N1, N2, N3, again N2, then REM sleep. REM sleep occurs as a person return to stage 2 or stage 1 from the deep sleep. Okay. There is a greater amount of deep sleep earlier in the night, while the proportion of REM sleep increases into the 2 cycles just before the natural awakening. Next, the factors, important one. Our topic is factors affecting the sleep only. Sleep is affected by both the internal and the external factors. The internal factors that affect the sleep quality include physical pain, strain, stress, muscle health, mental health issues, snoring and sleep disorders. The external factors include light, jet lag, medication, sleep environment, sleep schedule, caffeine and alcohol intake, uncertain food. These are all the external factors affecting the sleep. Internal factors affecting sleep quality. First one is physical pain. It makes you order to fall asleep. Pain is defined as an uncomfortable feeling that may include throbbing, aching or pinching, and it can disturb the sleep quality by making it harder for you to fall asleep or causing you to wake up in the middle of the night. back pain, neck pain, arthritis, or the common discomfort issues. If you are experiencing the pain and sleep that is disruptive, get a mattress with optimal support to keep the spine in a good alignment so that it helpful for you to go for your sleep earlier. The second factor, stress. It prevents the mind and the body from relaxing. Stress is a common culprit behind the sleep deprivation because worrying about some thought can keep people awake at night. In fact, an American Psychological Association survey found that 43% of adults reported losing sleep over stress. This can create a cyclical problem because of these people lost out on sleep, the stress level is increased. And sleep deprivation increases the stress level. Stress level increases the sleep deprivation. Same way, sleep deprivation increases the stress because it triggers an increase in the cortisol, also known as the stress hormone. Your body natural stress response also produces more adrenaline. The combination of these two hormones, adrenaline and cortisol, can elevate the heart rate, blood pressure and the blood glucose level. As a result, your body is less able to relax, and which is essential for falling asleep. Next factor is mental health issues. This also can result in a racing mind and the nightmares. Poor mental health harms the sleep quality, while bad sleep quality, it worsens the mental health. The major reason why the people struggling with their mental health have trouble in sleeping is often they can experience the nighttime anxiety, which is the case with conditions like anxiety disorder, bipolar disorder, depression, drug addictions, alcoholism, and panic disorder. Anxiety can negatively affect the sleep quality in two ways. The first, that anxious thought can prevent you from falling asleep. The second is the anxiety may lead to more disturbing dreams and the nightmares, which can prompt you to suddenly wake up. The difficulty in addressing the mental health issues and sleep is that it is a cyclical problem. Research shows us that people with mental health problems are more likely to have difficulty falling asleep or staying asleep. Next factor affecting the sleep is snoring. Snoring is distracting. Snoring can prevent you from having a good night rest because it is distracting. Snoring occurs when airflow causes a vibration against the relaxed throat issues. The reasons for snoring could be your body anatomy, sleep position, sleep deprivation, nasal problem, or drinking alcohol. However, snoring may also be a sign of obstructive sleep apnea. Sleep apnea. What is sleep apnea? Sleep apnea is a disorder in which a person starts and stops breathing while they sleep. And snoring is a symptom of this disorder. Tips to reduce the snoring include sleeping on your side or stomach side, and losing the weight, treating the nasal congestion issues, avoiding the alcohol before bed, and trying to get enough sleep each night. Next factor, sleep disorder. It also affects the sleep duration. Sleep disorders are specific conditions that affect the quality and the duration of sleep. The common sleep disorders include insomnia, sleep apnea, restless leg syndrome, and rapid eye movement sleep behavior disorder, narcolepsy. There are so many sleep related disorders. Some disorder may be caused by lifestyle or physical factors, while others are neurological. Therefore, regulating a sleep disorder will depend on the condition and what is causing it. Sleep disorders, the continuation of sleep disorder affecting the sleep duration. For example, if you have obstructive sleep apnea or insomnia, lifestyle changes may help to overcome that problem. However, disorders such as central sleep apnea or rapid eye movement sleep behavior disorder or narcolepsy are neurological and need more professional treatment. To improve the sleep quality, address the sleep disorder by practicing the healthy lifestyle changes or consulting with the doctor. If you are changing your lifestyle habit itself, be able to rectify much issues related to sleep. Till now we have discussed about the internal factors. Now the external factors that affecting the sleep. First factor is light influences the circadian rhythm. Light is defined as either natural daylight or artificial light. Light can affect the sleep quality because it influences the circadian rhythm. What is circadian rhythm? Circadian rhythm is the body's internal clock. It only regulates when we feel tired or alert. This is the regulatory mechanism within our body. Light signals to the body that it is time to be awake, while darkness signals gives that is the time to rest. The circadian rhythm responds to these signals by preparing the body to sleep or wake. For example, when it is dark, the body releases increased amount of the sleep promoting hormone, example melatonin. The second factor, jet lag disrupts the regular sleep schedules. Jet lag can enter the sleep by disrupting your natural sleep-wake pattern. Jet lag is a sleep issue that can happen when you fly across the time zone. As a result, you can experience difficulty in sleeping. To regulate the jet lag, slowly acclimate your sleep schedules to your upcoming destination. Additionally, if it is night time at your destination when you are flying, try to sleep on the plane. Gradually adjusting your schedule should help your body adapt to rest easier. And if you arrive at your destination and you are feeling sleepy, avoid napping right away. Get outside and use the sunlight to help you stay awake until it's the time for bed. Jet lag may also cause indigestion that keeps you up at night. Therefore, eat food you can easily digest for the first few days of your trip. Lastly, stay hydrated and avoid caffeine and alcohol, as this can worsen the jet lag. Next factor is medication. Medication can have negative side effects. Medications are liquid, pills, substance that treat the specific conditions and illness. Unfortunately, though, certain medication may also hinder the sleep quality by causing insomnia, such as alpha blockers, beta blockers, steroid and antidepressant, etc. There are different reasons why this medication can cause insomnia. For example, alpha blockers have been linked to reduce the REM sleep, the final stage in a sleep cycle and the time when the people normally dream. In the cases of beta blockers, they are linked to more sleep disturbance such as nightmares, waking up in the middle of the night. And steroid on the other hand can impact your body system that help you relax and sleep, which could result in bad dreams and trouble in falling asleep. Conversely, some medication and supplement could have a positive effect on sleep. Over-the-counter sleep aids like Benadryl, melatonin and valerian root are available to help you to rest better. The fourth factor, external factor, is a poor sleep environment. It makes staying asleep difficult. Sleep environment refers to the bedroom where you sleep. The bad sleep environment affects sleep quality by impairing your ability to sleep soundly through the night. The ideal sleep environment is cool, dark and quiet. The darker room fosters the tiredness by increasing the melatonin production, and experts recommend keeping your bedroom temperature between 60 and 67 degree Fahrenheit, which should keep it comfortably cool. Additionally, disruptive noises can disrupt your ability to fall or stay asleep. So, provide noise-free environment. The next factor is inconsistent sleep schedules. Make sleep less restorative. A sleep schedule is defined as when you go to bed and awaken. And inconsistent sleep schedules can negatively affect the sleep because it throws off your internal clock. These internal clocks control the physiological changes that helps you prepare for sleep and wakefulness. When these changes are not properly regulated, you could have difficulty getting enough quality sleep. Furthermore, a study reveals that irregular bed and wake up times are linked to a higher risk of metabolic disorder including obesity, high cholesterol, hypertension and high blood sugar level. Therefore, going to bed and waking up at the same time every day including the weekend should help you sleep better. Whereas, how to get on your sleep schedule, plan your bedtime and wake up time that allows you to get enough hours of short time and stick to that every day. Adults should get at least 7 hours of sleep every night. Therefore, if your wake up time is 6 a.m., your bedtime should be 11 p.m. or earlier. The next factor is caffeine. It delays the sleep onset and alcohol causes more disturbed rest. Caffeine and alcohol can impact sleep quality by delaying the sleep onset and causing the disturbed rest. Caffeine is a stimulant normally found in the coffee and certain tea beverages. So, caffeine and sleep are not a good mix because if you consume caffeine too late in the day, this could delay the sleep onset. Caffeine delays the sleep onset by blocking the adenosine receptors. Adenosine is a chemical in the brain that fosters the sleep and it increases throughout the day. However, caffeine can temporarily block the adenosine receptors and make you feel alert instead. Alcohol is a substance in a beverages such as liquor, wine, beer that causes the drunkenness. Although alcohol can make you tired initially, it is linked to more disturbed rest. According to health experts, alcohol can cause you to wake up in the middle of the night and have trouble falling to sleep. Go. Food. Certain foods can cause nighttime discomfort. We all know food is a source of daily nourishment and it can also influence the sleep quality by causing discomfort. Certain foods may cause nighttime heartburn and GERD, gastroesophageal reflux disease. Foods that can cause acid reflux or heartburn include fried food, fast food, pizza, potato chips, chili powder, pepper, fatty meats, cheese, tomato-based sauces, citrus, chocolate, peppermint and carbonated drinks. However, other foods and beverages can help regulate the acid reflux. These include whole grain vegetables, watery foods like celery and watermelon, herbal tea, milk and ginger. Secondly, eating too much before bed can cause uncomfortable indigestion that keeps you up at the night. So, instead of having a big meal, the best foods to help you sleep better are light healthy snacks that contain protein and minimal sugar. The importance of quality sleep. Getting quality sleep is important because it directly affects your physical, cognitive and emotional health. We need restorative sleep to have better cognitive skills, positive moods, and more physical energy. For example, if you are a student or employee, better cognitive skills can improve your academic and work performance. Additionally, a happier mindset helps boost your personal and professional relationship. And with the added energy, you can lead a more physically active lifestyle. Okay, we have discussed about what is the good effect of good quality of sleep. Now, what is the effect of bad quality of sleep on health? The effect of bad quality sleep on health is both physical and mental. The sleep deprivation effects can be long term as well. The long term physical health complications include hypertension, heart attack, stroke, obesity, diabetes, depression, and anxiety, impaired brain function, memory loss, a weakened immune system, decreased fertility, and many psychiatric disorders. To avoid these health issues, focus on getting optimal sleep quality and enough hours of rest each night. If a particular issue is causing you to experience the sleep deprivation, address the problem as soon as possible. Okay, what is the effect of bad quality sleep on daily life? The effect of bad quality sleep on daily life is also physical and the mental. Inadequate slumber can lead to less energy, difficulty in concentrating, and the negative moods. For example, if you are irritated because you didn't sleep well, this could hinder your personal and professional relationship. Bad sleep quality also puts you at the higher risk for workplace and automobile accident. To avoid these negative effects, prioritize getting a good night rest each night and addressing any issues that prevent you from sleeping well. Healthy lifestyle habits can also enhance your slumber. Exercise regularly and establish relaxing nightly routine to manage the stress, and eating certain foods can help to reduce heartburn and GERD, while avoiding big meals before bed and should prevent uncomfortable indigestion. Additionally, cutting back on caffeine and alcohol is important. Caffeine can make it harder to dose of and alcohol is linked to more interrupted sleep pattern. Okay, healthy habits. Avoid electronics before bed. You should avoid electronics before bed because these emit a blue light that delays the sleep onset. These devices include TV, cell phones, and computers. Furthermore, scrolling through the social media or the news could trigger the anxiety and stress, and that obstruct your sleep. Treat the underlying issues. Treating the underlying issues is vital for individuals with a sleep disorder that interferes with the quality of the sleep. With some disorder, a series of life cycle changes could improve the symptoms. However, you should seek help from a doctor or a sleep specialist for more complicated conditions. Till now, we have discussed about the various factors, the intrinsic factors and the external factors, how it affecting the sleep pattern. Okay. I hope you are all able to understand what we discussed now. Thank you viewers for your patient listening.